Well, thank you so much for coming. Nothing personalizes policy like healthcare. It affects each of us here, because each of us here, even if one of us is wearing a white coat, we are all patients. That's really what this is about. We need to stop this bill because it's bad for patients, it's bad for physicians, and it's bad for business. And lastly, there is a better way. One of the key components of Obamacare is to expand Medicaid. Approximately 50% of the people that are supposedly going to gain new coverage will do so under a new Medicaid program. But President Obama hasn't told you about Medicaid. A Government Accountability Office report revealed children and parents of Medicaid have worse access to physicians than children with no insurance at all. Even more, a 2010 study in the journal Cancer showed that patients with head and neck cancer had a 50% more likely chance of dying when compared to patients with private insurance. Even more, they had an 80% higher chance of having metastatic disease. Another 2010 study of almost 900,000 post-operative patients revealed that patients on Medicaid were almost twice as likely to die following surgery as patients with private insurance. In fact, even more, patients that had no insurance at all had a 25% better chance of living than patients on Medicaid. So this goes on and on and on. Another study showed that parents of children on Medicaid were denied specialty care 66% of the time, or they were denied 11% of the time if they had private insurance. If they did find a physician, they had a 42-day wait if they were on Medicaid, rather than a 20-day wait with private insurance. The same is true for access to dental care. But this isn't just about the patients, it's about a youth as well. There's another fascinating analysis that came out in my hometown of Hickory, North Carolina. There's a college there, Lenore University. Prior to this bill, students paid $245 a year for insurance. Next year, that's going to go up tenfold. You'll be paying $2,507 for insurance, which means those college students won't be able to afford their coverage. But it's not just bad for patients, it's bad for physicians. The Doctors Company did a survey of 5,000 physicians. They were just using a platform of insurance, so it wasn't skewed left or skewed right. They asked the question under the Affordable Care Act, how is this going to affect your plans to retire? 23% of those surveyed said they planned to leave or were very likely to leave medicine within the next 5 years because of the bill. Another 19% said they were likely to leave medicine because of the Affordable Care Act. That's looking at nearly 40% of physicians are seriously considering thinking of leaving medicine in the next 5 years because of the Affordable Care Act. My hometown, there are 2 emergency room physicians that just retired because of the mandated electronic medical record. And the list goes on and on. And this is bad for business. As we've just heard, there's UPS plans to drop coverage for 15,000 spouses. There's another study that was just released from Virginia saying they are planning to cut access to care for the spouses of their employees. But there is a better way. Too often the media tells us, well, where's the other plan? I was actually asked to write a healthcare plan for the Herman Cain camp. I wrote a paper, it's called Cutting the Gordian Knot, a patient-centered, fiscally responsible plan for reforming healthcare. So there is a better way, but to get to that better way, we must stop Obamacare. We have the perfect opportunity not only to stop it by defunding it and funding the rest of government, but this is a perfect opportunity to take this message to the American people, saying there is a better way. I'll close with one story. Government compassion sounds so noble, but in the end, whoever pays holds the power to choose. Barbara Wagner is a 64-year-old woman. She lived in Oregon. She didn't have health insurance, so she fell to the government-run program called the Oregon Health Plan. She developed recurrent lung cancer. She went to see her oncologist, and he recommended treatment with Tarceva, a new chemotherapy at the time. Well, she went to get her chemotherapy, but found out she couldn't. Instead, she got a letter from the state of Oregon, a government-run program, saying they would not pay for her chemotherapy. However, they offered to pay either for hospice or for physician-assisted suicide. Again, government compassion sounds so noble, but in the end, whoever pays holds the power to choose. This law fundamentally changes the nature of the patient-physician relationship. And what I see now is the infrastructure of our healthcare system is being destroyed. Now is the time to act. And I'm pleased to ask that you join us in taking this message to our congressional leaders. Thank you.